Hi, how you doing? My name is Richard Johnson. I'm a physical therapist assistant student at Professional Skills Institute. And today, before we start any exercises, I am going to take your vitals. Now, vital signs are very important because they're a good indicator of general health and your overall physiological status. Typically, I'll get your temperature too and ask you what your pain levels are. Today, I'm just going to get your blood pressure, your heart rate, and your respiratory rate. So first, I am going to get your blood pressure. What I'm going to need you to do is I'm going to need you first get good posture. Yep, don't cross your legs. Roll up your sleeves to about maybe here, up to about as close to your shoulder as you can. I'm going to wrap this cuff around you. Since we're doing the left arm, I am going to I'm going to palpate the brachial artery, and then I am going to position that there. Now, this is important. This basically is the force exerted by blood against any area of the vessel's walls. So I'm going to get both your systolic pressure, which is the blood pressure in the arteries when the heart pumps, and diastolic pressure, which is basically your blood pressure at rest when your vessels are at rest. So go ahead and kind of flip your arm a little. It's going to be a little above where your little space there is, where the little divot is. Outside of your elbow. All right, there she is. It's a little strong, cool. I'm going to put it about 2 inches above where I found it. Now it's going to be a little tight. And still there, good. All right, I'll get this guy untangled. All right, let's make sure this guy is. All right, so I'm going to need you to just relax, and then I will get your rate. And I will hear a sound as soon as the blood pressure in the arteries, when it kind of gets that heart pump. So just relax. There's a little bump there, all right. All right, so about 124/76 milligrams of mercury. So that's pretty good. Normal for someone your age is around 120/80. So no problems there. All right, so next I am going to get your heart rate. So the best place to do that is the radial artery, which is right where the forearm meets the wrist. So go ahead and turn your arm a little more. See if I can get right here. See if I can feel for that beat. I'm going to go ahead and start my stopwatch so I can go off that. And just relax. Let's see if I can find it. There it is. All right, so 36 times 2. Can you do that math? 36, 46, 52. No, 72. All right, 72 beats per minute. Again, Very good. Normal for an adult is between 60 and 100. So let me get it again. And then just relax. Go ahead and lean up a little bit. All right. So what I actually did there was I got your respiratory rate. So basically I was just counting how many times you exhaled. So you did it about, it was, let's see, I got it 7 times. So that's times 2. Of course, we know that. 14. So 14 respirations. So again, very good, because normal is between 12 and 20 per minute. So now I am going to explain how I would take vitals while someone is exercising. So this is sort of our fake new step, and she's going to pantomime doing the new step. So we're going to pretend she's on the new step. Typically I would wait, taking vitals during exercises is very important, especially with patients who have breathing problems, patients who are on ventilators. It's very important that you take their vitals so that we'll know whether or not we're able to speed up the service or add more intensity to speed up the exercise or add more intensity to the exercise, or if we maybe need to back down a little and find some exercises that are more towards their level of tolerance. So I would typically wait a few minutes, and then I would, in the case of the new step, I would go ahead, keep going. You're still going. I'd want to take her vitals while exercising. So what I would do is typically on the new step, I would slow down the intensity and tell her to keep pumping with just her legs, and then put her arm up here. Rest on there, just pump with your legs. And then I could basically do everything that I did before when she was at rest. I can pull up her arm, I can get her blood pressure, same way I did before. I can get her respiratory rate and get her heart rate. Typically, the heart rate will be a lot higher, obviously. The respiratory rate, she'll be exhaling and inhaling more per minute, and she will, typically the systolic rate in the blood pressure will go up, but the diastolic rate will sort of stay the same. So that's one way you could do it. One of the best ways that you could do that with these patients, and this won't make you have to slow down the intensity or anything, is usually you'll use a pulse oximeter. That's usually the best way to take, just kind of check in on a patient that can get their blood pressure and not also get their blood saturation levels, which are their blood oxygen saturation levels. Typically you want them to be at 92% or higher. That one is really easy. It's just a little clip that you put on their finger, and you wait about 5 seconds, and it'll give you all those readings just with that. So that's typically what you do with someone who is exercising.